Dr. Alan Kadish is president of Touro College, New York Medical College. What a great conversation we're having. I'm getting like all my diagnosis about you. You were a cardiologist?
So I am a cardiologist. I practiced in the Midwest for 22 years.
Wow.
And
Chicago.
In Michigan and then in Chicago.
Yeah.
Great town.
Yeah, I love that town. Did you see trauma when you were in Northwest? Was there a lot of? Were you in the emergency room in the trauma center?
So I didn't do the emergency room that much. The city does have its problems with trauma.
Yeah.
But where I was, I took care of people mostly who were not injured in that way.
In cardio. So you're telling me when I get my cardiologist, who is a great guy, and we're very conservative, but he's the one says, well, everything looks great. So that's when I get worried, when it's great. The carotid artery looks clear. We did that ultrasound. You're saying doing a stress test, nuclear stress test, don't take the radiation. You said it's as effective to do an echo right after the stress test.
Well, look, every patient is different. But in general, the results with the echo are just as good as the nuclear test.
Wow.
And it doesn't have radiation. So if you asked my opinion,
yeah.
I would say unless there's a specific reason to do the nuclear test, I would get the echo.
Yeah, because I'm afraid to take the radiation, Doc. You know what I'm saying?
So it's not a lot of radiation.
Okay.
You shouldn't be afraid of it.
Okay.
But if you have a choice, it's better to avoid it.
Yeah, absolutely. And then I had the, forgive me, Frankie Five Boroughs gave me a whole list of what to talk about measles.
No, this is a lot of fun talking about cardiology.
I am such a hypochondriac. So I had that calcium score test. The calcium score test, where I went in to see if the arteries were clogged, because I remember I saw a couple friends on TV had like stents, they had heart problems, and they looked terribly healthy. They looked remarkably healthy. Let me say it like that. And I went, and that came back okay. But you know, the insurance company got me, and I told this on the air before, because they said, "What, you got a calcium score test?" I said, "Yeah, why?" I said, "Because I'm a hypochondriac. That's why." They raised my rates. Isn't that great? You know, they think, oh, something must be wrong with you. But isn't it good to get the calcium score test, too? Do you need
the calcium score is good if you're in a category that's called intermediate risk, which means that there's some risk factors for heart disease, but not a lot of risk factors. That's where the calcium score can help to say whether more testing needs to be done.
No, my doctors they kind of just pandered to me, to my whims, and they said, sure, get the test. I just, I guess it can't hurt, but that's if you really think you have clogged heart, you'll be able to see the arteries clogged, right?
Well, you can't necessarily see the arteries clogged unless you have a special kind of calcium test. The regular calcium test.
I have to get another one now?
No, you don't need anything. You look good and healthy this morning. And you're laughing at 7:30 in the morning.
Oh, you're
in good shape.
You gotta live. I worry about that. You worry about that. How come people that look great and then they have a heart issue? And I see it all the time. I'm watching my friends on TV or something. Oh, he's off. He's having massive, heart surgery where they cut the chest, and then or somebody has a stent. That's scary. It's very, very scary that can happen like that.
It is, but these days we're able to identify it before you look bad.
Yeah.
So that's why you see people, they look good.
Yeah.
And that's why it's important to manage risk factors.
Yeah.
To try to decrease your risk of heart problems.
Does maple syrup help or hurt?
I'm not going to comment on maple syrup because I like maple syrup.
There you go. I'm the worst. I got some spray maple syrup for you. Dr. Kadish, the measles, we're all worried about. This is scary because here it is. Now we're is it an epidemic? Is it safe to say an epidemic in New York?
It's not quite an epidemic. I would say an outbreak is a better way to refer to it. Remember that there was one time before the vaccine when there were well over 500,000 cases of measles a year in the U.S.
Wow.
So now we're at about 800 or so. So it's not quite an epidemic, but it's certainly an outbreak, and it's certainly concerning.
60 new cases this week alone, correct?
That's right. It's not stopping. It's spreading. It hasn't gotten to epidemic proportions yet, meaning hundreds of thousands of cases.
Yeah.
But it's worrisome enough that we really got to be careful and take action to make sure it doesn't spread.
And Dr. Kadish, in your opinion, what's causing this rise?
We got complacent. We figured measles was gone, that it wasn't dangerous, that a disease that killed 100,000 people worldwide last year.
Measles did?
Measles did. Not in the United States.
Wow.
Because we have most of our people are vaccinated, and most children get vaccinated.
Yeah.
But we kind of fell asleep at the wheel a little bit and allowed people who question the vaccine not to get vaccinated. And when you get the vaccine rate below a certain point, below about 95%, That's when you can get these outbreaks. And we got there.
So the vaccination, everybody's anti-vax. They don't want to give the kids for religious reasons because they're thinking, like we were talking about with Frankie before we went on the air, of that's going to cause autism. And I was on that for a while. I thought, you sure the vaccinations don't cause Alzheimer's, attention deficit? None of that. You should and absolutely have to get vaccinated. Yes?
You should absolutely get vaccinated. The autism thing is a myth, an urban legend. There was one paper written by a now discredited British doctor that has been debunked.
Wow.
600,000 kids were studied. There was no relationship between autism and the vaccine. Everything you do in medicine has risks. There's some tiny risks to the vaccine, but it's really safe, and it really ought to be done because we are at a place where if we don't get control of it, measles can come back.
And if they don't get vaccinated for religious reasons, I mean, that really, you hurt your child more than anything else when you go down that path, correct?
So, look, I never want to tell anyone else what they should do with their religion.
Sure.
But in general, if you're putting not just your child, but the community at risk, it's hard to understand why you wouldn't get vaccinated.
It's true. You have a great bedside manner, Doc. Can I tell you what? Can I tell you about
so
my
your
cholesterol?
Shoulder's bothering you now? We got through the heart, you're fine, and now we're onto your shoulder?
I'm thinking the shoulder I can deal with. What's more vital that I could really sponge some free medical advice from you this morning? I was going to ask you about cholesterol. My doctor says to me, my doctor, Vinny Boombat, my doctor says to me, take the Crestor, man. Your cholesterol, because I guess it's hereditary. He worries about that. And he never worries about anything. He says, make sure you take the Crestor because and I'm thinking, sometimes cholesterol is good. There's good cholesterol and the bad cholesterol, but if it runs high, it's okay to take the Lipitor and the Crestor. You should stay on those. That's a danger in causing heart disease, correct?
So if you're at a certain risk, the recommendations are that you take it. And while there are some side effects, there are hundreds of thousands of people who have been studied to show that if you need it and you take it, you'll live longer. You can be on the air longer.
There we go. I can have more children if I want. I'm just saying, I got an 8-year-old at this point, but I love it, and I feel energized. But hey, Doc, tell us, before we let you go, and you've been very, very patient, Dr. Kadish, thanks so much. Tell us about Touro College. How much do you love leading Touro College over there?
So Touro has 19,000 students.
Wow.
It was started by a great visionary who was the only president before me, who hired me when I was 94. When he was 94.
Yeah, you got it. Yeah.
It's a mission-based school. We have two main missions. One is to provide for people who can't get education otherwise. And we run 5 medical schools.
Wow.
We have a law school and a business school. We're not a religious institution, but we are an institution, what we call in the Jewish tradition. And so we do have some Jewish studies programs as well.
Yeah.
And it's a great place. I've been there for 10 years. We have students who succeed tremendously. And we had graduations this season. So I was just at graduation on Sunday, Lincoln Center. See kids starting a life, excited.
Yeah.
Great place.
Yeah.
And I love it.
Dr. Kadish, you're a good guy. Thanks so much. Thanks for letting us have some fun and keep us posted. But again, onto the measles thing, because it is getting scary. It's certainly in New York. Get vaccinated. Don't mess around.
Everybody needs to get vaccinated. It's going to help not just you, but the community, and we got to be part of the community.
Yeah, thank you, Doctor. Good to see you, Dr. Kadish.
Great
to see you. I'll be visiting you after the show today for a second opinion. I'm so sorry. I am the hypochondriac, the germaphobe, and the maple syrup junkie. Thank you very much. All in one on AM 970 The Answer. Curtis Ellis.